Now, Singapore is adjusting its measures on the community as the COVID-19 situation continues to evolve. From the 29th of August, odd and even date entry restrictions will be implemented on weekends at Lucky Plaza and Peninsula Plaza, the first such restrictions on shopping malls. The multi-ministry task force said this is to better manage crowds and ensure that safe distancing can be observed. Our reporter Cheryl Goh brings us the latest from a media briefing earlier. Now, Cheryl, tell us about the updates then to the community measures.
Yes, that's right, Steve. So authorities have observed that there have been large crowds, specifically at Lucky Plaza and Peninsula Plaza, especially on weekends where there are long queues to enter these two malls. So that's why they are implementing the odd and even entry system. So basically, it's quite straightforward. It means that those whose NRIC end with an even digit, they can only visit these two malls on dates that are on even numbered dates on weekends. And the reverse is true for those with odd numbers. So this is actually not a new measure. It's been done before at popular markets like the Geylang Serai market. And the task force did say that other malls or premises that perhaps may face similar crowd management issues will also be required to adopt this entry system. There's also been updates to food and beverage restrictions. So they have tightened the rules to allow recorded music at F&B outlets to be played only as soft background music. So this is because the task force and authorities have observed that some F&B outlets are blasting the music, and this is causing the diners to speak loudly, and this also could increase droplet spread. So they're trying to not ensure that doesn't happen. They're also urging Singaporeans not to book multiple tables at restaurants. This has been observed through large group gatherings where they sit at perhaps 2 or 3 different tables of 5. So they're only saying that only if they are members of the same household who are bigger than 5, then yes, they can book that. Otherwise, restaurants and F&B outlets are encouraged not to accept such reservations. And there's also a bit of good news in terms of there will be more public facilities available for outdoor exercise from the 1st of September. And this includes more spaces at Sport SG centres as well as HDB common areas. Let's hear what the task force has to say about this.
As number of workers in the workplace go up and interaction at the workplace go up, you also will expect to see the number of cases in workplaces to go up correspondingly. And therefore, it is very important for us to re-emphasize the safe management and safe distancing measures at workplaces so as to reduce the risk of transmission in the workplaces. But we do expect that as you have more people going back to work, you are bound to have higher number of cases to be observed daily.
And Cheryl, were there any updates on vaccine though?
Yes, so the task force said that there's no further detailed information about vaccines at this point. However, Singapore does continue to work very closely with the WHO, the World Health Organization, on its COVAX facility efforts. And it's also looking at how vaccines can be made available to the public when they are ready. Let's hear from Mr. Gan again.
Suffice to say that we are making progress and we are actively participating in many of these negotiations in the multiple fronts. As to the deployment of the vaccine, we have to bear in mind that there may be different candidates of vaccines that may become available, and some of these vaccines may be suitable for certain groups of people, may be not suitable for other groups of people.
So the task force also did preempt that no formal decisions have been made, and they also did want to stress that the vaccine, when it does become available, will not be available in large quantities simply due to the global demand for them. And so therefore they need to prioritize how to use these vaccines perhaps for vulnerable groups and maybe frontline workers in the healthcare sector. So at this point, there's no other decisions that have been made, and there's also no decisions been made to see whether there will be mandatory vaccines at this moment for the public. Back to you in the studio.
Very much for that update, Cheryl Goh.